course. So the study that we did was the Harris Poll Migraine Report Card Survey. And what we did in that study is we compared the self-reported migraine experiences of 550 US adults with high-frequency headache and migraine and acute medication overuse. And we compared those individuals to people who previously experienced high-frequency migraine and acute medication overuse, but are currently having a sustained reduction in frequency. And for the purposes of this survey, we defined high frequency migraine and acute medication overuse as at least 8 days per month with headache or migraine, and with at least 10 days per month of acute medication use. And the main thing that we found in this study is that despite our advances in migraine treatment options, many aspects of patient self-reported migraine experiences have remained unchanged between the current high-frequency migraine acute medication overuse group and the previous high-frequency migraine and acute medication overuse group, particularly with respect to disease burden, including the quality of life, mental and emotional health, as well as a low use of preventive treatment options, regardless of which cohort the survey respondent was from. And so overall, the survey underscores the negative impact of migraine on the quality of life, on mental and emotional health in those individuals with current and previous high-frequency migraine and acute medication overuse. And it really uncovers persistent barriers that we have in both the diagnosis as well as the treatment of migraine. Yeah, I mean, we found these results somewhat surprising because we expected to see more differences between these two cohorts. We expected that those with previous high-frequency migraine and acute medication overuse who were currently having reduced frequency of headache days and migraine days, as well as acute medication days, would have less burden of disease. They would have improved quality of life. They would have better treatment and better perception of their HCP and patient communication, but we didn't. And so this is the big learning, is despite these advances that we've had in migraine treatment, we still have a high disease burden. And so when we look at the implications of the study, we really want to break down the different areas that we looked at. One of the areas that we focused on was the quality of life. And again, there are very few distinguishing characteristics or factors between previous and current cohorts with regards to overall health, impact on life, impact on quality of life, and also the impact on the mental and emotional health. And that really indicates that there is, despite sustained reduction in headache and migraine frequency and acute medication use, there is still a substantial burden. So over 50% of these survey respondents self-reported that headache still had a negative impact on their quality of life. And so the implication is that regardless of these advances that we've made in migraine treatment, there is still a mismatch between these advances in the field and with advances in the field with all of our novel treatment options and the actual impact that these advances are having on patients. There is still a high burden of disease regardless of previous or current frequency of headache and migraine days and medication use days. Now, to learn a little bit more about that, we can then look to the part of the survey where we looked specifically at treatment. We looked at acute treatment and we looked at preventive treatment. Interestingly, when we looked at acute treatment, we did find that this was one of the very few areas that there was a separation between the previous HFM and acute medication overuse group and the current HFM and acute medication overuse group. What we found is those that previously had a high frequency of migraine and high frequency of acute medication use reported better acute treatment optimization compared to those that were currently still in that high frequency and high medication use pattern. So we learned from that the optimization of acute treatment of migraine is very important to reduce the burden of disease. However, the top goal for respondents in both cohorts was to prevent headache and migraine days. And despite all of the respondents being candidates for migraine prevention, only 15 to 16% were actually using a preventive medication at that time of the survey, and only 25 to 32% had ever used a preventive medication. So this is consistent with the literature and prior reports, but we had thought that with all the treatment advances that this would actually be better in our survey, and this would possibly be a differentiating factor between those two cohorts. But it wasn't. Prevention is still very low, unacceptably low in these cohorts of patients. And so, like you asked, why? Why is it still low? Is it under diagnosis? Is it under treatment due to misalignment of communication during the visit? Are we not meeting the patient where they are? Are we as healthcare professionals not asking the right questions? Or is this about access to medications or barriers because of step therapy? Or is it access to neurologists and headache specialists, which we know is low because of just the paucity of headache specialists and even the paucity of neurologists? We also then looked at the communication and the potential barriers of communication between healthcare professionals and patients. And many of the survey respondents, more than 1/3 of the survey respondents, wished that their healthcare professional better understood how headaches and migraine affect their mental and emotional health. About 1/3 or more of the respondents with current or previous high frequency migraine and acute medication overuse wished that their healthcare professional knew why they had headaches. So maybe we need to do a better job of aligning with our patients during our visits through more streamlined communication to explain what is migraine, why are they having headaches, why should they use acute treatments or preventive treatments, and then also talk to them about the impact of their migraine and headache days on their mental and emotional health, because these are the things that the patients have self-identified through this survey as barriers to reducing the burden of disease.